23 is the objective for this evening is to discuss what's happened the past year. I think 23 is the year after 22, where the COVID and all the lessons we had from COVID and how we can do digital outreaching and how we should reach out of the hospital to people, to patients, to the care. One. Secondly, it's my first year. It was my first year as CNO, so for me it was a new experience where I learned a lot about innovation and all what's giving the future of innovation. If you're looking to the definition of innovation and the innovation waves we have had the past 100 years, you can say that actually we have about the sixth wave, and the sixth wave is determined by data. The previous waves were by oil and by coal and by steam, but the data boost, the data source is one of the most important drivers, I think, for the coming years coming up. If you are relying it or looking for it in the healthcare, then for myself, I made the distinction between 2020, the year that COVID began. Previously, we had the curative physical healthcare, which after the Second World War, incremental growth by drugs, penicillin and all these things. 10 years ago, we had the value-based healthcare, which came up. Then we had digital healthcare, which is the main subject, I think, of the discussion of this evening. And in the future, we will have the smart hospital and all about preventive healthcare in the care continuum. So these are the five areas which will become important in our next healthcare systems. So about value-based healthcare, I will not go in detail. Everyone who's involved in the care sector and hospitals have the idea what is value-based healthcare. It's quality about cost. So we have to prove and we have to target for value for our patients, and also looking for outcomes which are relevant to patients and also the costs. Also there, when you want to have a good value-based healthcare program, you need data, you need digital health, you need prom and prems. So again, the data concept is coming in the value-based healthcare. But what is digital health? I looked a lot, and I was, as a previous clinical doctor, not CEO. For me, digital health was the apps and the monitors and all these things. But if you look for the definition of digital health, which has been determined by the World Health Organization and European Commission, you can say that digital health is the field of knowledge and practice associated with development and use of technologies to improve health. Digital health expands the concept of e-health to include all consumers with a wider range of smart devices and connected equipment. So also the areas which are commonly understood as being part of digital health is AI, big data, blockchain, health data, and all the things you are mentioned here, which are coming up, but this is all covered by the term digital health. So if we are discussing digital health, all is in what has been proven and what has been written down. Looking for the data, the European Commission, Europe has said, okay, we will create a space, a European health data space, for regulation of the data, to be legal, to be correct with all regulations, but also to be a promoter of using data in the future, because this is a very important one in the hospital of the future. We come around it in a few minutes. Digital Europe is a community of healthcare and providers which are all concerned about this digital health. And they defined an action plan where they go from ambition to action, how they hope to reach complete digital Europe the coming 10, 15 years. Without going in details, it's an important one. They want to demonstrate benefits for all health consumers. They want to leverage all existing data sharing platforms which are already there to perform better. Very important, they want to go for data protection. So the data protection board becomes a very important one in Europe because, okay, you can have data, but how you do handling data, you have the privacy regulation, you have GDPR, and so on. So this is a very important one. And also you have to go for patient-centric services around patients, so use data around patients. And there's an important one is the way how we use the patient data for secondary use. Actually, we should go for opting out series, but we cannot do actually. So if a patient wants to give his data for the healthcare system, he has to opt in actually, and this makes a very big problem for doing it, for doing it easily. But this is the plan of Digital Europe to change it at the European level. So a lot of people are thinking about the future. For those who is interested at home, a very interesting one is the Future Health Index 2023. This is a yearly exercise that is covered by the company of Philips, where they try to have an idea within 3,000 healthcare leaders and healthcare professionals, so as well young people, older people, experienced one, how they see the future at short term for the healthcare systems. And you see, okay, there are three things they all summarized. To tackle the staff shortages which are coming up, we need digital innovation. We had to bring healthcare closer to our patients, and finally, we have to partner within the healthcare system, ecosystem, as well with the colleagues around us, but also with all the sectors which are concerned about digital health, which are concerned about data, so IT companies and so on. So this is an important one. It comes every year and gives you a clue where we go and where we will evolve as healthcare systems. This is the future. Also again, it's a position paper of Philips, which is describing how will the smart hospital of the future look like, and they define it very well. The smart hospital of the future, it will be a hospital without walls. Why should we change from system? It's clear, the demand for care outstrips the supply. You know that 1 of the 3 patients in the world has some chronic diseases. We know there's a very shortage of nurses and all paramedic personnel, also doctors. So in the future we will have a lack of it. So we have to look for systems, for methodologies to change and to adapt the physical care we have person to person into another way of caring for people. And there is digital health and digital care, a very important one. We also know that the younger people, the younger patients in the future, they love digital things, they love data, they love these systems, and also they expect to float away from the physical contacts with doctors to the digital experience, where they can have the same results, or hope to have the same results as in the actual system. So this is an example how it could be in the future and how I think it will be in the future. If you look how smart ecosystems of care are evolving, I think we all know that actually we have a care continuing. It's the upper side. We go from healthy living and prevention, which is monitored and which is structurally helped to prevent becoming sick. You have the diagnostic part, you have the treatment and the recovery part. So this is called the care continuum. And in this continuum, you have 4 levels of care delivery methods. You have the virtual care, all the apps and all the monitoring facts. You have the possibility in the future of the mobile care. It's already coming from some screening projects, but in the future, perhaps it will be clinics on wheels. You will have the walk-in care, diagnostic one-stop shops. There are countries, perhaps, where you can go at the supermarket and can have perhaps a visit with a family doctor of some basic diagnostic things. So it's coming up in certain countries. And you have, in the future, the new hospital care is the specialty care, and there we can go in more detail. So this is, I think, a very beautiful way to present a possible care system. It's already there a little bit in the United States. Kaiser Permanente is one of them, where you have around the patient a digital system of several locations where you can get your care. It can be a regional hospital far away. It can be a clinic, polyclinic outside the walls of the classical hospital. You can go for specialty hospital, focus clinics. You can go for the classic hospital. The transport modalities will become very important. The ICU mobile is existing, so you don't need an ICU unit in every small clinic. You can have a mobile ICU, which is resembling a physical ICU, so to resolve this problem of acute intensive care. Perhaps you will have skilled nursing facilities, so you don't have to look for a doctor or a clinic. Now you can go to a facility of skilled nursing, and you have the home situations where with all digital possibilities you can monitor people and patients at their place.
I see that Stephen has a question.
Yeah, sorry to interrupt.
No.
But now I'm thinking, in the American system, America, whatever you do there is business. Everything is business. So if you make healthcare a business, then pathology or sickness or illness also becomes a business. Mm-hmm. And then the definition of what is a sick
what
people,
is health?
what is healthy
health?
and what is not healthy becomes a very strange definition with a gray, it becomes a gray zone. And people may be lured into, hey, you're unhealthy, you should go search for care, even though perhaps the reality is that they are not sick. Mm-hmm. So I don't know if I'm explaining myself, but we need to be careful that healthy and sick or ill people, that these definitions remain, correct definitions.
I agree.
And I know in Belgium it's not going to happen that this is going to become a business, but in Kaiser Permanente, they live off, obviously.
This is Kaiser Permanente is one of the examples, but if you're looking to big countries with big distances where you cannot get your care, mm-hmm. Australia, all these things, there I think the system can be worthwhile. Certainly if you're using digital health, digital data, to do predictive analytics. I look to Peter. He has experience.
So you're a data guy, of course. Obviously, Yeah. But the question is a bit more philosophical, I believe.
Yeah, but on the other hand, Kaiser Permanente, they prove that mortality, you live basically 10 years longer at Kaiser Permanente compared to average US life prediction.
Right,
so there's really because of a digital way and having a really good data householding, it seems to really have an effect on your life expectancy. So I think in that respect, I understand your question, but yeah, it seems to have a positive.
No, I'm just being a little bit provocative.
Sure.
I know much less than you guys. Well, I'm just shaking
I think by capturing digital or data points or health data points on a digital way, on a current way, on a continuous way, that you're more able to catch up these people who are silently going in a bad way. Mm-hmm. And if you apply predictive analytics on it continuously, then can predict that something will go wrong. And it can be in sick people, certainly, in home care or in elderly care. It's already there that you can monitoring people because these are the sick, the very high potentials of becoming sick. But also in the primary situations and the preventive situations, there's a lot of people who are becoming sick, but who are not captured. So if you can target with data to target for these people, sugar.
So the red lights are already on before the signs or the symptoms develop.
This is the way to go.
Exactly.
That's okay.
Yeah.
All right.
So you really have, like for example, on Mayo Clinic published lots of AI models on ECGs to predict like atrial fibrillation, even
beforehand.
Exactly. So and then thrombosis, etc., are really prevented.
I have a question about that.
That is fantastic, because if that is digital.
This is digital health. Yeah.
It might be fantastic, but also very dangerous. What happens when insurance companies are getting these data?
This is always the confounder. Therefore, you need your regulations on European level that data remains your own data and are protected. So therefore, the whole system of data governance is a very important one.
Right. Yes.
But it's possible.
Yes, and also that's why in hospitals we do feel that the hunt for data is increasing by the month almost. Yes. So you really feel like there's a pressure coming, and we have to really organize ourselves to really get a proper governance, like you mentioned.
Yeah, because obviously pharma industry is going to be very much interested in data like this as well, because they don't have access to this kind of data either. Right?
But therefore, in hospitals, you see in Europe, they have the system, they have the regulation to protect data. I think also in hospitals you need a very strict data governance, where you have really need to data protection board to discuss the real world data, how you use secondary data, secondary use of data, patient data. So you need a governance which is supervising and governing all the demands of companies. But also sometimes the spontaneous way of doctors who are not confident and who are not aware that there's a danger of this. So you need the governance about, and this is very important.
We had also the discussion before, of course, that we said also what is the governance is doing actually. Is the law protecting us, or what is your idea about that, Peter?
I don't think that the law is really protecting us fully. You really have to do it yourself in your hospital because, for example, a retrospective clinical trial, like a couple of years ago, it was really a trial. Nowadays, it's like sometimes, if you really look to it, it's more like a way of getting data. And there's like data brokers filing clinical trials. So you feel that it's shifting. So you really have to organize your hospital to cope with this new world, basically.
It's new, but it's not so easy because even as doctors not aware of this problem, you're perhaps giving your data without having the idea to be commercial, but you give your data. So this is not allowed anymore, and you have to protect your patient and this data because it's.
But you're both chief innovator officers of your hospital. So do you have a juridic department working very closely with you then?
We have.
Yes, we do.
Because because I hear that this is becoming a really very important issue.
We have staff. I have a staff member, two staff members which are involved, and we have a committee which is coming every month. Do we discuss all projects which has been demanded by data brokers? Because actually you have data brokers without putting names on it, but you have X, A, Z, and they come with projects from companies to say, okay, look for all prostate cancers of Dr. Joniot in the past 10 years and give me the data or all these things. So you have really, and it's we studied at our level. The board of directors is getting the demand, so we are studying with the board of directors to what's in. Is there a danger of it? It's studied by a staff member. It's studied by the DPO, which is looking for it. So
what is DPO? Sorry.
It's the data protection officer. So you have 3 or 4 people who are looking for the specific demand for real world data, and only when it's approved, it's all correct. That we say, okay, you can get it, and you can commercialize or not, but the main target is to deliver safe data to those who are asking it.
I remember, Filip, that you said there is other ways to provide data. There is ways of providing data in a sense that the data becomes some sort of artificial, or how did you say that again?
Yes, you have actually. So there remains a problem of data of patients. Are this data anonymized or not? Pseudonymizing, perfect anonymized. It's very difficult to have real anonymous data. But there's a system, and Peter can discuss about it. They call it the scientific data. So you have a system where you have, imagine that you have 100 patients with 100 data points. There can be a mathematical model where you're shifting all these data points in these 100 patients, you make your calculations, and you come back to the original data set of this patient, but Peter is more used to this. This will be the solution. This will be the solution in the future.
Data with partners, even the pharma industry or data brokers.
But synthetic data, of course, if you then train a model, training an AI model requires some subtle changes, which are really the goal of training an AI model is basically getting the information that's really embedded in the data. Right. So if the data is synthetic and a bit scrambled, you're basically getting scrambled information.
Yeah. Okay, so
then you might have to retrain a bit or redo your homework a bit.
It's not ideal.
Okay. It's not ideal, no.
But it's in progress, and perhaps it's the future of having...
I think I personally believe more in like federated systems, where you really have the data stays in the hospital, and then the analysis is like on a trusted third-party server, which goes to the different hospitals, and then this way gets like a mutual understanding of what's happening across all hospitals. That's
and the data then remains within the hospital. The hospital.
Yes, it's fully under control of the hospital.
And it's also double because it's already so difficult to collecting data. Yeah. Because we say so when we're doing one PSA, we have so many laboratories who are doing it, but we want to have it. How is there a system you have, Peter, to collect that? But that's not easy. For me, it's not too easy. Of course, we have our the letters that we are make. Sometimes they're good, sometimes very good, and most of the time they're bad, I suppose. I don't think what you were thinking about.
So speak of your own hospital.
I know. No. So it's and then PSA is a funny one because then you have also the different vendors of the PSA system. So and then you have to really calibrate and all these things. So we basically because we train the AI models also on combining MRI results with PSA, we found that we had really terrible results. And then we really adapted and our way of thinking. And we started thinking a bit more like a clinical trial, where you upfront think of what data do you want to be able to make like a decision with a certain power and a certain certainty. So why don't we use the same philosophy in the daily practice? Like, why don't we think upfront of what data do we need at which timestamp in the total path of a patient to have like a fully correct description of what the patient is really experiencing through the flow. So therefore we started shifting like, okay, we should take a blood sample at the time of when the MRI is taken, so that you have like time synchronicity. And by doing so and structuring it, we really saw a huge improvement in the predictions. So I truly think if you can capture data at the correct timestamp in the correct fashion, you make a big difference. And it's not a matter of just getting like lots of data, but it's better to have a bit less data, but good data, good quality data.
And also what I've heard also, so it's that you make some structure inside, but it's really as a kind of a process that you're doing, not only data. So you say, are you doing at that moment?
Yes.
Especially, you say, no, when I'm doing the MRI, I will do my PSA.
Yes.
And that's what you're saying.
Yes,
so
exactly. So we took it from Karolinska. It's Professor Martin Ingvar from Karolinska started with it. He published a really nice paper on this. And that's where we took a bit of mustard. And we started implementing, and we truly see a big advantage. Also, I think if you take it this way, you standardize things a little bit. You keep the therapeutic freedom that physicians are really caring about. But by standardizing these things a little bit, you also come to better quality markers and everything. So there's like lots of side effects which have positive implications for patients.
That's one of the things that we experience as clinicians. And so we just want to do our job. And we don't want to collect parallel to that data. So we need a facilitated way of collecting data. And yesterday it was Andries Klinkert who was talking about this and how to better implement these data capturing systems into your daily clinical practice, so that it doesn't really add effort, but the data is collected That's the ideal world, I know. So it's not so easy to improve.
But we will need it. We will need this kind of data within the several EPDs we have in our Belgian healthcare system. To if you want to compare prostate cancer or whatever cancer on the same data points, they have to be structured, and they have to come in a federated system to be analyzed and come back. So you need this parametric dashboard, this parametric way of getting your data.
But now it seems that all the efforts to achieve that is left to the hospitals. And is the government doing anything to
we have not a unique EPD.
No, I hear you guys see that. But the framework above this should... Okay.
They try, but they are too late.
They're running behind.
There are like data capability initiatives and so on, but then the money spent there is like also diverting, you see. It's just not like coming to a truly harmonized data system. So it's a bit of pity.
Right.
Yeah.
That's the fact.
Filip, I have another question regarding your hospital of the future. I see patient is in the middle.
Yeah.
Who is managing the patient? Because when I would be that patient, I wouldn't know where to go.
Well, this is the main role of the hospital of the future. So the hospital of the future, they have to shift from a physical hospital where they are delivering all care to some coordinating system where they have really big role to coordinate care for specific patients. So this is a different role. It's mentioned on the slide. You have to shift from the physical way of doing everything to coordinating your role. So you have to be the English term is you have to be the cockpit. The cockpit.
Will it be? Is it the hospital who is a coordinator, or is it the physician?
I think the home physician wants to do it, but the shortage also there. So with the help of smart data, with data and all the systems, this can be and should be, I think, a role of the smart hospital, but which is looking for all this care, all this kind of care. It's outreaching care. It's getting data. You have to be experts. You have to have experts which are interpreting. But all these systems are coming and already there in some countries where you have a real observation rooms on intensive care, one room with 40 screens and which are covering 40 ICU units.
So it's like air traffic control.
Yeah, it's an air traffic control with very high level people who are looking to data.
A nice example on this is Radboud UMC. They
do that?
They're monitoring their patients full time on the 7 parameters. And then, for example, during COVID, where patients were desaturating, they saw it because they are not looking to just data points. Because they are monitoring continuously, they see trends.
Right.
And the trend, of course, is much more informative than just a data point. And because of this, they could just turn the knob, add a bit of oxygen, and by noon the patient was okay again, turn it back, and that's it. Well, in our hospital, the patient probably would have gone to ICU. So that's the difference of just doing a continuous monitoring. So it's a nice.
That's super.
Very nice.
It's summarized on the slide. It's with introducing your digital technology, you have to go for operational efficiency. So optimize workflows and resource utilization to free up focus for patient care. You have to go for experience centricity. The experience of patients within and beyond hospital walls is very important. And you have to go for clinical excellence. So using all these data-driven insights, doing predictive analytics, you have to go for a higher quality of clinical care and efficiency, which you can do if you have the good techniques. But it takes time to introduce all these things and to have the up-leveling. But finally, the most important one is that you should have your organization ready for innovation capability. So your organization should be agile enough to go for it. You should have teams of clinicians. You should have teams of data scientists, of the IT technologists to do this innovation capability, because this is the most important one, that in a hospital which is having their classical healthcare, you should have a possibility to go for reform. You have to explore the new, introducing digital health in your system, while exploiting the know, because the things has to go on.
Yeah.
In English they call it the ambidextrous organization. Flemish is the tweehandige organization. So you have to write down at the same moment, in the same hospital, in the same organization, these two things. And it are different things. You have your classical doctors who are performing their work, but you should have the space and the time and the possibility and the money and the resources to also let the people which are innovators on digital way to also have their pathway to go. And this is a complex thing which we have. So this was one of my first tasks to look for how can we do in our hospital as CEO for Maria Middelares in Ghent, how can we go for this ambidextrous organization? And the first thing you are doing is looking around. We are in Ghent, so you look around. And I should say one of the examples which were really convincing me that this is possible is the radar construction in Delta. So I'm happy, Peter, that you're here and that perhaps you can explain a little bit how you were able to get this philosophy of ambidextrous organization in your hospital, because this is a very important one, which is very important to succeed and to be successful.
Yeah. So normally in innovation you have like the 2% who is really willing and jumping around to start with the new things. And then you have the 15% who is a little bit looking from the side, but from the moment they see something, they jump in. Then you have like the 65% who's really following. And then you have 20% who's doing nothing. So who's against? So the last 20% you basically forget. So don't worry about them. So you start with the 2%, and then of course you need to make sure you have funding. So there's like in innovation, if you know a bit the way, there's enough funding for innovation, so you can really start with this. And then you start to have some successes. And from there on we grow organically. So we just didn't push it. We didn't advertise really a lot also in the hospital, because we have today we have like an innovation model where we really work for physicians for true clinical problems. We try to solve clinical problems. But if you there are a lot of clinical problems.
Of course.
So if you really advertise for it, you basically won't be able to follow.
No.
So, and that's why we are now at the stage where we should expand the team to a size where it's basically not affordable anymore. So that's where we now jump into the point where collaboration is really the key.
Yeah.
Yeah.
So I truly think that in digital and in data, it is going to be all about collaboration. It's like you say, sharing is caring, right?
Yeah, sharing is care.
Yeah.
It's becoming care. It's really very
I fully agree. They call it the ecosystem you have to build up, and the ecosystem has to be. You see it also in the profit sector. Right? The big guys are looking for each other to have specific parts to make the best iPhone or the best car. They are getting together. They are concurrents, but they are going together for having some upper level. Because you need it, everyone has expertise, and you don't have the resources actually. Certainly not in our healthcare system in Belgium, but not worldwide. So you have to collaborate for it. So it's very important. Yeah. So to finish, how did we do it in our hospital? We shift a little bit another way. It was asked to me, how do you do it? To really wake up these innovators, which are also in our hospital, there to stimulate them and to get the other people around. So we also have the construction of the main hospital, like in the smart hospital. We have some peripheral clinics, and we have another lesser specialty clinic. We have our board or hub where we are concentrating, like rather the people of data and AI and all the people on quality. So they are all together. And we thought we needed a visual. Why do we need the visual? Because we were convinced that in our hospital we had all these things living apart, but living apart together. And it was not coordinated. So by making a visual, by making it the rocket to the future, the future model, where we have all the items where we were working on but all separately and not coordinated. We went for the rocket. The top is patients and families, so it's the value-based healthcare. The value we want to construct it around real health value, medical devices, AI, precision medicine, connected care and integrated care, and extended reality. So this is creating value. We have command centers, so several committees which are looking up and controlling it. We have the fuel. This should be where this transformation is, but the fuel to do the rocket is teaching. You need a learning organization. You have to teach. You have a learning. You need a learning organization. You need data. So this is a real project. You need a governance. You need a data team to fuel this thing. You need funding. The funding is actually in our clinic. It's mainly by the doctors which are putting self-funding. It's a self-funding, so you have to go for external funding, but you have to go for partnerships. It's very important that you can't do it all yourself any longer. The transformation should be on quality, innovation, clinical research. It should be constructed by ESG, so it's a topic which is there, but which will remain social, governmental, and environmental. It should be in the four levels of the 4 places we are working. So in the hospitals and also in the polyclinic situations. And it should be at the bottom, it should be founded by the strategic goals of your organization. So this is our model where we work on it. We are continuing to show it to our doctors, to stimulate innovation, to stimulate in the system, but like you say, to limit, not to overflow, because the demand will come to grow. But again, quality, innovation, and clinical research are really the main drivers. And it's summarized how we look for it. We look for health value in the smart hospital of the future. How we will do it, by having the rocket, the way we want to go to the future, and structured on quality, clinical research, open digital innovation within a structured platform and collaborative way with all partners, as well as other clinics, as well as industry, and so on. So in this way, we have our health value space again. I think this is a model of our clinic. You have your model, Peter. I think other clinics also have their models which are coming up. But all those who are not working still on it should go for it, because this will be the smart hospital of the future, where you have to govern data and all these things to get further away. So this is my conclusion for this evening.
Thank you very much, Filip. Filip, Peter, are you believing in rocket science? Or do you think that another model can help also? Because everything is included here. It's really a kind of mission.
It's a mission. It's going for the future, because the future is there, and it can be a race car, it can be a rocket, but it's some symbolic things. But the main thing, I think, is getting an image as well for your coworkers, as well for the external people who are looking to your organization, for what is our goal, what is our mission, what is our vision. And then you can show something. They say, this is our core. Totally. This is our real core, and there we are working on. And then you can go for collaborations and cooperations.
Yes.
That's my...
Is there, in your model, but maybe I've missed it, but what is becoming more and more interesting and important is that the patient can stay in their home situation.
Yeah.
Even like in Japan, more and more patients are receiving chemo at home.
Yeah.
So this way of thinking, is that implemented as well?
Well,
because so far maybe...
I didn't go in detail, but it's there in one of the parts, is connected and integrated care.
Yeah.
This is one of the things we are really working on with the digital health, the connection you have.
Yeah.
So it's really in this part of value creating in the connected and integrated care model.
Okay. Because that is something that in my mind is going to become more and more important, because by 2070, the median age of men before they die is going to be 90. So we're going to have a huge number of elderly people who we cannot possibly put all these people in a hospital or a care situation. So we'll have to be able to compensate for that. it's a far future, but it's coming our direction, right?
Yeah, and it's a really interesting thought because like technology is doubling the capacity every 2 years. It's Moore's law.
Yeah,
right.
So like we're now 2024. By 2026, we will produce as much as semiconductors, so computer power, as the last 50 years in 2 years' time.
Ooh, okay.
So it's doubling every 2 years. So it's an exponential growth of digital capacity. So that's what we are looking at. So that's why we are able to get more and more data to really see more and more in a granular way of how health is developing and how do we have to care with people. So maybe is that causing aging, and then aging is causing more data? Is it like, I'm not sure how it is.
It's probably both. But what I mean is that the patient who is elderly then with the problem, the data is not going to save the patient. You're going to need people to take care of the patient. So you're going to need mobile equipment.
But the data
certainly it's
mobile teams who are... So the hospital, I saw it. It's really great. So the hospital future is not anymore a building, which is the hospital, and then a general practitioner and maybe a polyclinic in between. It's going to be a team of, an interconnected team around the patient, and the GPs are already building this type of,
Yes.
But I think also that early detection will be becoming really an important shift in healthcare.
Well, I think the discussion is becoming way too interesting. The rocket has a lift-off.
They hopefully don't come down.
Yeah. Unfortunately, I think we have to conclude this session.